Did you know that fibroids are a major health concern in Sub-Saharan Africa? But what might be the reasons behind this trend? In the vast expanse of Sub-Saharan Africa, a silent epidemic is sweeping across the region. The culprit? Fibroids. These benign tumors, which grow in or on the uterus, are alarmingly common among women in this part of the world. In fact, the prevalence of fibroids in Sub-Saharan Africa is so high that it's raising eyebrows among health professionals worldwide. To help us understand this, we turn to Maureen Umeakwevulu, a consultant obstetrician and gynecologist who has been on the front lines, witnessing the impact of this health crisis firsthand. In her work, she has seen how fibroids affect women's lives, their health, and their hopes for the future. But why is this region particularly affected? What are the factors contributing to this high prevalence? These are the questions we'll be exploring in this video. Now that we have set the stage, let's delve into the reasons behind this prevalence. So, what are the reasons behind the high prevalence of fibroids in Sub-Saharan Africa? A question many of us may have. Maureen Umeakwevulu, a consultant obstetrician and gynecologist, provides some insight into this. One of the key factors she mentions is genetic predisposition. It's like being dealt a hand of cards at birth. Some of us are predisposed to certain health conditions, fibroids being one of them. This is especially true for women in Sub-Saharan Africa. Another factor Maureen discusses is dietary habits. Yes, what we eat can influence our health in more ways than one. A diet high in processed foods and low in fruits, vegetables, and whole grains can increase the risk of fibroids. Lastly, there's the issue of healthcare. Many areas in Sub-Saharan Africa lack adequate healthcare facilities. This means that women may not be getting the necessary checkups and preventative care they need. This can lead to a higher risk of fibroids going undetected and untreated. Understanding these causes is the first step towards addressing this issue. However, recognizing the symptoms is equally crucial. But how can one identify if they have fibroids? And what are the treatment options available? Fibroids often present themselves through a range of symptoms. According to Maureen Umeakwevulu, a consultant obstetrician and gynecologist, common signs include heavy menstrual bleeding, persistent pelvic pain, and frequent urination. But remember, these symptoms can also be associated with other conditions, so it's crucial to seek professional medical advice for a proper diagnosis. Once diagnosed, there are several treatment options available. Medication, for example, can help to manage symptoms and slow down the growth of fibroids. In more severe cases, surgical procedures like myomectomy or hysterectomy may be recommended. However, surgery is usually considered as a last resort when other treatment options have failed. Moreover, lifestyle changes play a significant role in managing fibroids. A balanced diet, regular exercise, and adequate sleep can contribute to overall well-being and help the body in dealing with this condition. While these treatments can help, recovery is a crucial part of the journey. So how can one recover from fibroids, and what role does nutrition play in this process? Let's delve into the advice shared by Maureen Umeakwevulu. Recovery from fibroids is a journey that requires a multi-pronged approach. Firstly, a balanced diet is essential. Consuming nutrient-rich foods, especially those high in fiber, can help in the process of healing and recovery. It's crucial to fill your plate with a variety of fruits, vegetables, lean proteins, and whole grains. Next, regular exercise is not only good for overall health, but also plays an important role in recovery. Physical activity helps to improve circulation, reduce inflammation, and maintain a healthy body weight, all of which are beneficial in managing fibroids. Lastly, regular medical checkups are vital. Keep up with your doctor's appointments and follow their advice to the letter. This ensures that any changes in your condition are detected early and appropriate measures are taken swiftly. In conclusion, fibroids are a major health concern in Sub-Saharan Africa, but with awareness and appropriate health care, we can combat this issue. Remember, your health is your wealth.